This is Nursing Assistant online prep course. We are starting Unit 8. This is Section 1, Key Terms. Our first term is aspiration. Aspiration is when a resident inhales liquid into the lungs. They can also inhale food particles, mucus, vomit, anything that they inhale into the lungs is aspiration. It is most commonly liquid that they are consuming. Our next term is CVA. This is a cerebral vascular accident, more commonly known as a stroke. This happens when there is an interference with normal blood flow in the brain. We have two types of a stroke. There is a blood clot that blocks blood flow, and there also is a hemorrhagic stroke, which is where there is a brain bleed, so the blood flow through the normal vessels is interrupted. Our next term is dysphagia. Dysphagia is difficulty swallowing. This can be caused from a lot of reasons. This can be caused from disease process, such as dementia or Alzheimer's. There are neurological diseases like MS, Parkinson's disease. This can be caused from a stroke. Anything that causes difficulty swallowing. Our next term is essential nutrients. Essential nutrients are things that we need for our body to maintain function. We use these for disease prevention, for growth, good health. We have to have these provided in our diet. These are found in things like proteins, carbs, fats, vitamins. Our next term is MyPlate. The MyPlate is an illustration that the FDA, the Food and Drug Administration, put out. This is to help people understand portion sizes, what they should be eating, how to have a healthy, balanced diet. Our next term is nutrition. Nutrition is the process of how our body takes in food and fluids and uses it for what we need, for growth, for repair, and for maintenance of our health. This is continuing Unit 8, Section 1. Our next section discusses the USDA Choose MyPlate. MyPlate is an illustration from the USDA, so United States Department of Agriculture, that helps Americans choose healthy portion size and healthy diet choices. The plate is divided up into how much of each type of food we should have on our plate. It also discusses how often we should be eating these foods. We should be choosing things that have higher nutritional value to eat more frequently. Things like fruits and vegetables and whole grains and low-fat milk products or dairy products, lean meats, poultry, fish, legumes or beans, also for protein, eggs and nuts. Things that we should be limiting our intake of, things that have saturated fats, trans fats, high cholesterol, salt, or added sugar. When we have good nutrition, our body has physical signs of that good nutrition. Our hair is in good condition. We're more alert. Our eyes are clear. We have an appropriate appetite. We have healthy elimination patterns. Our skin and nails are healthy and in good condition from good nutrition. Good nutrition helps us sleep better. It helps us maintain a good, healthy attitude. Our elderly have the same nutritional needs as anyone else. How they meet those needs is what is different. We need to help them meet those needs. Some of them maybe just need minimal assistance, all the way to being needed to be completely fed their meals. We need to help them and encourage them to have good nutrition and good hydration. Unit 8, Section 1, continuing. There are some factors that can affect the nutritional needs of the residents. There are some physical factors. Fatigue level. How alert are they? Are they in pain? What are some disease processes? All of those things can affect how our residents are eating and taking in nutrition. Sensory loss can affect how a person eats. If a person has decreased smell, it doesn't stimulate the appetite. They may not want to eat. Things like vision deficits, hearing deficits, decreased taste, all of these can affect our residents' appetite and how much nutrition they are taking in. Physical comfort. We want to make sure that our residents are sitting comfortably at the table to be able to eat. Or if they're in their room eating, make sure that they're comfortable, whether that's in bed or in a chair. We want to make sure that they're not having pain or that that pain is being managed so that they are able to comfortably eat. There are some positions for safety. We discussed high Fowler's position. This is going to help prevent aspiration and choking. This is also for comfort while a person is eating. There are some concerns with teeth and dentures. If we have residents that have their own teeth, we want to make sure that they're in good condition so that they can chew appropriately. For residents that have dentures, we want to make sure that those dentures are in. We want to make sure that they fit well, that they're in good condition so that they can, again, appropriately chew. If a resident has some swallowing difficulties, you want to make sure that you're observing for that. If a resident is clearing their throat or coughing during eating between bites, please notify a nurse so that the nurse can observe and see if they are having swallowing difficulties. If you are feeding a resident, make sure you are giving them time to completely empty their mouth before giving them the next bite. Make sure that they're not pocketing food in their cheeks. Make sure that we're giving them drinks of fluid between bites of food to help with chewing and swallowing. There are some psychosocial, again, emotional and mental things that affect nutrition. There are cultural influences, things like religions, traditions, cultures, family customs. What are the types of foods that this person has normally consumed? Emotional factors like loneliness, depression, anger, anxiousness, frustration. What's their mood? Your mood affects how you take in nutrition. If we have residents that have eating disorders or have some unacceptable eating patterns or eating habits, all of these things can affect how they take in nutrition. And then environmental factors. We want to make sure that mealtime is pleasant. This is a time for them to socialize. Food is a very social thing in most customs, in most cultures, in most origins. So we want to make sure that we're providing a good social experience for them in a pleasant atmosphere while they are eating. Talk to your residents, converse with them while they're eating. Hopefully this is a relaxing, pleasant environment for them. If you are assisting a resident with feeding them, make sure that their tray is positioned so that they can see the food and so that you are sitting across from them so that they can see you. Make sure that we are eliminating any unpleasant odors where that resident is eating. Make sure that they are clean and comfortable and positioned well. Make sure that hot foods are served hot and cold foods are cold so that the meal is as appetizing as possible.